Like many countries across the world, Nigeria is at present experiencing the third wave of the COVID-19 pandemic with the spread of the Delta variants. There have been weekly fatalities, particularly in some states such as Lagos, Akwa Ibom, Rivers, Oyo, Ogun, and the FCT. Government says plans are being put in place to mitigate the rising of these variants as it is considered to be 60% transmissible.
The country is particularly concerned about the Delta variant because it is much more transmissible. It has been estimated to be 60% more transmissible, which means that where one virus of the previous variants will infect 100 people, this particular one will infect 160 people. That's a lot. Secondly, this variant is also of concern because it affects even younger people. So the non-pharmaceutical interventions, that is to say the public health measures, are still extremely important because that is the main weapon we still have, and it works.
At present, there are 38 high-capacity oxygen plants in the country, with 12 oxygen taps waiting as backups. As part of preventive measures, a high-power surveillance is being effected at the ports of entries across the country, with stringent border control testings.
What tools do we have in detection? We are definitely not where we were earlier. We have our warehouses are full of laboratory tests. We're supporting the states to use this. We're thinking of different methods to increase access through whatever program is already existing in the states. So by detecting more, we're able to respond, and the states have done an incredibly good job, most states, in scaling up not just the lab capacity, which is something we talk about all the time, but sustaining the people that are collecting these samples.
With 70% of the eligible population being targeted for vaccination, only 2.3% has been recorded so far in the country. Meanwhile, 176,000 doses of Johnson & Johnson vaccines and many others are expected in the country soon.
These Johnson & Johnson vaccines are going to be prioritized for those who live in the hard-to-reach areas, the riverine areas, mountainous areas, itinerant workers, people who we have concerns that once they take the first dose, they may not be available for the second dose. And using GIS technology, we've been able to map practically all populations in Nigeria. We know where these hard-to-reach populations are. They are the ones that we're going to be prioritizing to give the Johnson & Johnson vaccine.
With more fatalities already recorded due to cholera outbreak in 22 states and the FCT, it is not open to questioning that other public health emergencies are claiming more lives than COVID. Therefore, the government must be urgent towards resolving the ongoing resident doctor strike, if only to save the nation's health sector from imminent collapse. Adegboyega Arogbodo, LTV News, Abuja.